Hello everyone. Today is May 28th and this day is marked internationally every year to celebrate women's health, International Women's Health. And happy International Women's Day everybody. I am Dr. Sree Durga. I am the consultant fertility specialist at Virinchi Fertility Center. So why are we bothered about women's health? Obviously, we make half of the society, so healthy woman is equal to a healthy society. So obviously, women's health is quite in quite a few ways it's different from a man's health, and our health is an example of the health of the population. And we might have heard this definition a million times, but I'm still repeating. The definition of health is just not mere absence of a disease, but it's a state of physical, mental, as well as social, or let's say emotional well-being. And especially in our women, somehow it's extrapolated to reproductive health. Shall I tell you some interesting key facts? All over the world, a woman lives in an average 4 years longer than men. Well, I think it's a surprise thing for quite a few of us. When statistics were taken a decade back in 2011, the woman's life expectancy at the time of birth was more than 80 years in nearly 50 countries, let's say 46 countries. But let's come to African countries, it's hardly 58 years. And we all know girls are more likely to suffer from young girls from sexual abuse compared to boys. And in adults and girls, especially from the well-affluent countries, road traffic accidents are the leading cause of death. And just listen to it. 99% of the deaths that happen during pregnancy or during childbirth, what we call maternal deaths, that is nearly 3 lakhs, they occur in developing countries. Hardly 1% happen in the affluent countries. And the heart problems, it's mostly thought as a male problem, man problem, but still it's the #1 killer even for women folk. And among cancers, the breast cancer is a leading cancer killer, especially in the women between 20 to 60 years of age. So let's do this in age-wise. So adults and girls in 10 to 19 years. So we all know that what adults and girls go through. And they suffer, little bit emotional disorders, let's say depressive disorders in adolescent age group, and also schizophrenia. These are the leading causes of ill health. In addition to that, leading to self-inflicted injuries, road traffic accidents, like I mentioned a little bit before, and drowning. But these are especially most in affluent countries. And the statistics from a decade back in 2011, at least, 8,20,000 women and men aged between this young age group, 15 to 24, are newly infected with HIV, especially in the developing countries. And more than half of them are women. And somehow girls, adolescent girls and young girls are twice likely to get infected from this HIV compared to the young men. And obviously this is because of unsafe sexual practices. And these adolescent girls, if they get pregnant, we all know that it is an increased risk for them as well as for their newborn babies. And more than 15 million of 135 live births that happen worldwide, they happen in that adolescent age group. 15 million pregnancies in that age group. And obviously when these age group girls get pregnant, they resort to unsafe abortions. An estimate of 3 million unsafe abortions occur globally every year in this adolescent age group. And obviously unsafe abortions means the complications associated with these unsafe abortions, and therefore the health issues with this. And coming to affluent countries, now even in countries like our country, adolescent girls or adolescent boys are increasingly getting exposed to alcohol, substance abuse. So that is another added issue. In some places, girls are using tobacco and alcohol nearly as much as boys. And WHO statistics from one of the affluent countries, the Americas, 23% of boys and 21% of girls between the tender age of 13 to 15 reported that they smoke. In that last month, they have smoked. And coming to the nutrition bit, we got data from 41 countries, half of them at least. In half of them, the data showed that more than 1/3 of the girls aged between the adolescent age group 15 to 19 are anemic. And mostly the anemia is because they're not eating properly. It's an iron deficiency anemia. And therefore, the iron deficiency anemia again leads to decreased immunity, and therefore it leads to increased sepsis when they get pregnant, in case they get pregnant, for unsafe abortions, leading to bleeding, hemorrhage, etc. Plus, anemia is not only lead to other problems. If you're anemic and you're weak, you're down with your immune system, and also with, your brain doesn't work well if you're diseased, especially anemia. So it causes cognitive and, that's a growing phase. So it causes physical deficits in young children, and obviously it reduces the productivity when you become adults in a couple of years. And the next age group, when you become pregnant, the main issue is the maternal health. And the maternal deaths, that is deaths during childbearing or pregnancy, are the second biggest killer in the reproductive age group. And every year, like I mentioned before, nearly 3 lakh women die due to complications of this pregnancy and childbirth. And 99% of them, they happen in the developing countries. Despite the increase of use of all these oral, contraceptive devices or pills over the last 3 decades, still, many women still in many developing nations or underdeveloped nations, they don't have access to this modern contraceptive methods, especially in sub-Saharan Africa. 1 in 4 women who wants to delay or stop childbearing don't know what to do. They don't know anything about family planning. So this is just a quick life cycle approach to reproductive health. So women are not spared from the birth till they die. So if you can see, even in infancy, we are harmed just for sex selection, female infanticide, genital mutilation in some countries like Somalia and other sub-Saharan countries. Then when you hit adolescent, I've told you, unsafe abortions because of early childbearing, sexually transmitted infections, especially HIV, and malnutrition. And when you hit into your reproductive age group between 15 to 49 years, in addition to these unplanned pregnancies and sexually transmitted infections and unsafe abortions, pregnancy complications as such, in addition to malnutrition, and when you cross the reproductive age group, then the lifestyle diseases start hitting us, especially the heart problems, cardiovascular problems, the cancers, the gynecological cancers, bone problems like osteoporosis, osteoarthritis, diabetes, etc. Plus, in addition, lifelong, I think everywhere we are subject to gender violence and leading to psychological issues. So women's health concern, why are we bothered about women's health? Always about women's health rather than much about man's health? Because from family to careers, typically we are the ones who neglect our health. The focus is always on our husbands or children. So now I say, or we all say, first take care of yourself. Take care of yourself. This is a wellness wheel, socially, physically, spiritually, everywhere. Take care of yourself. And why is it important? Because it's linked to your child, who is a part of the family, and family is a part of the whole society. If the woman is healthy, the society is healthy. And the key factors for a woman's wellness especially is deep relaxation, a good sleep, and strive to balance everything, your career, your family life, everything. Enhance detoxification methods, boost your metabolism, calm your mind. And how all these things can happen? Optimum nutrition. Try to balance your hormonal levels, try to take mineral and vitamin supplements, a good intake of water, and boost your metabolism by exercise. And wellness diet doesn't mean a diet for a few days, in a month or 2. It's a nutrition for your life. So what to eat? This is nothing new I'm talking, but I'm just emphasizing. So variety of fresh foods are the key to nutrition. So whole grains, beans, fresh fruits, vegetables, green vegetables, berries. Use olive oil instead of those ghees and processed or vegetable oils. Green tea, organic food, and what to avoid. I've told you what to eat, what to avoid. Avoid everything that looks white. All these refined flours, that maida and everything, white sugars, especially those white breads, the sweet bakery products, the packaged snack foods, artificial sweeteners of your food. And don't go for high carbohydrate or too sugary food. Avoid full fat dairy products, chicken skins, and these fatty meats, red meat. And coming to exercise, how much to do, what to do, just half an hour exercise per day, at least 4 to 5 days a week is more than enough. Just brisk walking, running, these are the simple things, cycling, skipping. Just if you love dancing and swimming, and core exercise like weightlifting and push-ups, walking or jogging in the park, and our age-old yoga, pranayams, and meditation. Well, I don't have time, madam, for all these. Just, everyday activities just boost your metabolism. Just take stairs instead of lifts, and try to park your vehicle a little bit far away from your office. Or if you're not using your own vehicle, just get down the bus one stop ahead. Or you like gardening, and even at work, just take in the break time, don't chat, just roam around, boost your metabolism a little bit. And what does this exercise do? It improves your heart, lungs, cardiorespiratory, and your muscle fitness. Your bone health, it improves. And it has shown that it increases your biological or metabolic health biomarkers, and therefore you're at a low risk for heart diseases, heart attacks, stroke, blood pressure, diabetes, etc. Plus, it lowers the risk for even cancers like your breast cancer or your bowel cancer, your uterine cancers, etc. And you're fit. That means you don't gain weight and you look fit too. And it reduces psychological issues, especially your depression, and improves your cognitive function, especially when you start hitting your late 40s and 50s. And manage stress. We all know we are the best jugglers in the world. We try to manage everything, and what it does to us, it hits our health. We have digestive issues, our immunity gets compromised, we strive to sleep a good, we struggle to get a good night's sleep, we start putting on weight. And CDC estimates that nearly 75% to nearly 90% of women's visits to doctors are stress related mostly. And even that's been proved by even American Psychological Association, that somehow stress is a common factor for women and men, but somehow we, the XX species, that is our women, are more affected by stress rather than men. And that leads to engaging in some unhealthy behavior sometimes. So let me just class it down to simplify it too. So what should we all do? I'll start with adolescent till the menopause. So teenagers, look after your menstrual health, give importance to vaccination, especially our human papilloma vaccination. And this is the age where your ovaries start getting active, and we are noticing polycystic ovaries showing its effect from the adolescent age itself. So leading to all these pubertal problems, cosmetic issues of hair growth on your upper lip, pimples, etc. And in your 20s and 30s, and you're married, you're planning to start a family, so think about contraception, or else think about starting a family successfully. Go for regular pap smears to prevent cervical cancer later. And you're planning for a pregnancy, screen for rubella virus, because it's known to cause some issues in the developmental issues in the newborn. And definitely folic acid supplementation if you're planning for a pregnancy. So time of choices is a time when you're in your 20s or 30s. This is the time you need to make choices, right? Yeah, either it's career or family. So somehow we have to get a balance. So for a healthy pregnancy, start with preconceptual care, take all the multivitamins and multimineral supplements, at least see that you get 400 micrograms of folic acid supplementation, and be active, stay fit. And please, if you're planning for a pregnancy, stop down all your smoking and alcohol. And if you're too much into coffee consumption, reduce the caffeine intake. And what late 30s and late 40s, this is a time, a lot of hormonal changes are happening. The phase what we call as perimenopause. So nowadays 40 is called as new engage. So you still don't forget about your contraception. Sometimes accidents can happen at this age, and we know pregnancy in late 40s can lead to genetic problems in the baby. So So contraception, just keep a note on it. You might be going through those menopausal, start of menopausal symptoms. This is age where we start noticing that we are putting on weight, and do consider use of prophylactic calcium now only. Don't wait till hit your menopause. And occasionally or very regularly check your fat content, that is your lipid profile. And you hit your late 40s or your early 50 or 50 plus, this is a time we have to live well. So it's a time for living well. So this is a time where we have to manage all those lifestyle diseases. Perimenopause is that late 40s or early 50s. So this is a time leading up to the menopause, and it is a natural part of aging. We can't avoid it, right? That signals the end of your reproductive years. Your ovaries shut down. Therefore, you make less hormones, estrogen and progesterone. And you hit 50s, that's where your grandmom instincts start hitting you. So dadi, nani, you like to be called as that rather than mom now. So, but you will be going through all these phases again. So hot flashes will be hitting you because of the menopause, and because of the low estrogen, you will be having vaginal dryness, frequent, urinary infections. And because of lack of estrogen, there will be somehow drop in calcium metabolism and drop in bone density. Frequently check your blood pressure and diabetes, and also go for breast screening, mammography and bone density scan. And you've crossed your 60s, still you need to exercise, have healthy diet, and still weight is, I think, what we women go through this weight management till till late age as well. So look into weight management as well. And this is a high risk time for heart disease, and also your reproductive organ cancers like your ovarian, uterine or breast cancer risk is quite high once you start entering your 60s. And not only that, because of lack of hormones and tissue laxity, these benign causes of discomfort, these are not life-threatening, but quite major discomfort causing conditions, like where your uterus is pulled down, what we call medically as vaginal or uterine prolapse, osteoarthritis, etc. And few more interesting facts: an average woman loses 5 pounds of muscle every year, every decade, whichever age group you belong to. And you add on 10 pounds of fat every decade. So you lose 5 pounds of muscle and add 10 pounds of fat every decade. And by 50, you lose 1/3 of muscle mass. By 60, your muscle mass is reduced by half. And among that, with a high percentage of body fat, you put on fat. So we emphasize, why doctors emphasize on the screening tests? That's because we can diagnose your before even you develop the symptoms of the problem, and better to diagnose early and treat it early in the early stage. And which screening test you want to have, it depends on your age, your family history, and as such your own health condition. So these are the few screening tests what we women go through. For breast cancer screening, we go through mammography and ultrasound of the breast, and for cervical screening cancer, we go through pap smears. Pap smear is not a painful, it's hardly a 5-minute procedure. Just we scrape the neck of the womb, which we call the cervix, and then we look under microscope for any cancer cells. And thanks to this vaccination, Cervarix and other types of vaccines, best given in young women under the age of 25. So, but still, it doesn't protect against all the cancers. So still, it only prevents against certain strains of HPV, but other causes of cancer, cervix, it doesn't prevent. So still, routine pap smears are still important in spite of getting the vaccine. And for osteoporosis, that's where your bones become weak and fragile because of less calcium. So your bone density gets lowered. And how to measure your bone density is by DEXA. Through DEXA scan, you can predict your bone strength and whether your bone is more vulnerable to break or not, from that. And know your numbers. The numbers are for your high blood pressure. So the normal range is 120/80. So if it is crossing 120 and touching near 140 on the upper side, and the lower side it's touching 90, then you're prone to diabetic, what we call pre-hypertensive. And once the upper side crosses 140 and the lower side crosses 90, that means you're termed hypertensive and you need a doctor's help. And again, know your numbers. Keep your cholesterol be below 200. Keep your bad cholesterol, the LDL, below 100. and try to keep your HDL, that is a good cholesterol, above 50 or even higher. And diabetes, so there are different types of diabetes where you're born with it, type 1 or adult onset type 2, or the diabetes what you get in pregnancy, the gestational. So get screened for diabetes. Even look after your eye health as well. That's glaucoma is where your eye pressure increases after certain age, especially after 40. So get your basic eye examination starting around 40 age group. And vitamin D deficiency, I mean, this is a super molecule, so it is the defense for your health, this molecule, and because its deficiency can cause muscle and bone pain, and somehow it increases the risk of diabetes as well, especially the type 1. And this vitamin D is the one the body makes when you give vitamin D rich foods, and you have to expose yourself to the sun. And these vitamin D rich foods are cheese, butter, margarine, or the fortified foods like cereals and milk, etc. Plus sunlight helps the vitamin D from these foods to get absorbed into your bones. So this is just a quick slide of the health screening from different age groups. So if you're in the younger age group, so at least get one pap smear. You come to your mid 40s, you have to go for mammogram plus pap smear, regular pap smear every 5 years. You crossed your 50s, that's where your bone health worsens, so get even your DEXA scan, that is bone density scan, in addition to mammography and cervical screening if you're due for them. So it's never too late. Don't think, oh, I have not done all this, it's too late now, there's no point. No, it's never too late. Take care of your body. So no matter whatever age or whatever stage you are, adolescent, reproductive, or you hit your 60s, it is essential for every woman to eat healthy, be active as well, so that you can manage stress and take supplements wisely. So that's the mantra for women well-being. And thank you. Any questions, you can post me and I'm happy to answer.